Hi, I'm here to talk about the difference between prebiotics and probiotics. And what are they? This should be quick. Prebiotics are the ingredients to make the probiotics. So prebiotics are typically in fibrous foods, and your gut will develop bacteria from these fibers. And one of the byproducts is actually a really hot topic right now is the hormone GLP-1. And you can actually create that in your body to help with satiety and to help with satisfaction and to push away food so you're not eating as much if you have that fullness factor or your body says, we're done, we don't need to eat any more food. Probiotics are the different strains of bacteria that could live in your gut or could contain your gut microbiome. So people will say include pre and probiotics. So prebiotics, again, are the precursors to the different biotic strains, if you will. And then the probiotics are going to be the actual different strains. So sometimes people will take a capsule or a supplement of different strains of probiotics with a lot of colonizing forming units. That means that they're actually taking strains that can hopefully bypass the mouth, esophagus, stomach, small, and going to kind of get to the second, third part of your small intestine, the jejunum and the ileum. The duodenum is also where you can develop some short chain fatty acids, also where you can absorb some foods, but you want to get it to the second third of your small intestine and then also into your long intestine. You want some of the fibers to be there so you can have a 15 to 20 foot long, really healthy gut microbiome. That's how long your intestines are. If you were to disconnect it from the end of the stomach to your anus, it would be about 15 feet long. If you were to slice open and kind of open it up with all of the microvilli, they're like the little finger-like projections that are inside of the intestine, it would be the size of about a tennis court. So the surface area of how you absorb your food is pretty big in your body, and that's where the gut microbiome, it changes so often. It's so hard to pinpoint what you need exactly. You could do invasive testing like a scope, either upper or a lower. You could do different stool testings. There's so many things you could do. Some I would say are legit. Some I would say, just proceed with caution and see kind of the angle of what the company is trying to test and then what the intervention is. But overall, if you're having enough fiber in your food and you're getting fermented foods, you're probably okay. But again, also what can affect the gut is neurotransmitters, your emotional state, your stressful state or your stress reaction, your autonomic nervous system. So many things can affect how the gut functions. So it's always nuanced. It's never black and white. And it can be really difficult and really frustrating if you're in a lot of pain because it's never an easy answer, ever. It could be simple, but not easy. So hope this helps if you pay attention to language and marketing or health spaces that talk about pre and probiotics. Okay, have a good day. Bye.